This is an educational video on how to prevent transmission of Middle East respiratory coronavirus infection. Symptoms of MERS-CoV appear like flu-like illness, including sore throat, runny nose, headache, shortness of breath, and fever. Occasionally, symptoms may manifest as vomiting or diarrhea. Non-compliance to infection control practices can lead to outbreak in healthcare institutes. Cover your mouth and nose with a tissue when coughing or sneezing. Dispose of the tissue in the nearest waste receptacle right after use. Perform hand hygiene using hand washing with non-antimicrobial soap and water or alcohol-based hand sanitizer after having contact with respiratory secretions and contaminated objects or materials. A visual triage nurse identifies a patient with respiratory symptoms and asks him to wear a surgical mask. The nurse is using the checklist in order to score the patient if he needs to be isolated. Infection prevention and control precautions when caring for patients with suspected MERS-CoV. The following precautions must be followed in the following sequence when donning protective gear. Do hand hygiene. Put on yellow gown. Put on N95 mask. Test efficiency. Put on goggles or face shield. Wear the gloves. Nasopharyngeal swab should be taken and collected in viral transport media. The following instructions should be followed when doffing protective gear. Remove gloves. Do hand hygiene. Remove goggles or face shield. Take off yellow gown. Do hand hygiene. In the anteroom, remove N95 mask and do hand hygiene. The doctor is filing the information on special requests and call MOH hotline 937 to report the suspected MERS patient. You are stable to go home, provided that you will be isolated until we call you and inform you about the result. You should stay in a different room from other people in your home. Also, you should use a separate bathroom if available. Cover your mouth and nose with a tissue when you cough or sneeze. You should not share dishes, drinking glasses, cups, eating utensils, towels, bedding, or other items with other people in your home. Wash your hands often and thoroughly with antiseptic soap and water.